Hi, everybody. I'm Jack Canfield. Welcome to the show. Joining me today is a phenomenally cool guy. He's a great guest. His name's Dr. Alan Lindemann. He's an obstetrician. He's delivered over 6,000 babies without any maternal deaths. He wants to educate pregnant women about some of the techniques he's learned over the years for a safe pregnancy and a really smooth and safe delivery. And he's produced a video course containing some of this information. We're going to talk about that. And he's working on an upcoming book called Safe Pregnancy, Safe Delivery. So welcome to the show, Alan.
Yes, thank you, Jack, very much.
My pleasure. Really glad to have you here. I think this is such an important topic. So why is this topic of safe pregnancies and childbirth experiences so important?
Well, one of the things I learned as a student and resident is that in obstetrics, and that's the only field of medicine that is this way, but you can have a lot to say about your outcome. In other words, you can pick your outcome most of the time, not all of the time, but certainly more than 90% of the time. So we talk about things in the video, ways to negotiate or travel through the pregnancy safely.
And what got you interested in this subject?
It's the idea of choice. In other words, if I can present a mom and dad with choices during their pregnancy, I think they have a better outcome. We work together, and that's always been my passion. I've even invited children, of course, their children, to come to the prenatal visits.
You talk about maternal mortality rate being really high in the United States. And obviously, when you're a couple, whether you're young or you're middle-aged, whatever, you want to have a safe pregnancy. You want the mother to be safe. You want the child to come out healthy. You want the birth to be as painless and as not complicated as possible. But we have a higher mortality rate than most countries, and here we are, one of the most modern countries in the world. Why do you think our mortality rate is so high in the United States?
Well, I think there's several reasons for it. In the first place, there are countries that have a 2 or 3 per 100,000. In the United States, we run anywhere between 14 and 40 per 100,000. We certainly have the most expensive healthcare on the planet. But there are 3 reasons that I think we don't do so well. One of them is a CDC term called deny and delay. In other words, patients get sent home from the emergency room when they really should be staying in the hospital. You have also fragmentation of care where providers don't talk to each other. Years ago, when I sent a patient out of the hospital, I had to summarize the entire course on 1 page. The idea was that nobody would turn to the second page. So we had to have priorities. Today, I get 75 pages of confetti, computerized junk. And so we have that. And then we have also the problem with payers trying to manipulate healthcare. And that takes away their choice.
Yeah, you say the payers, the people they're kind of getting in the way there of people being able to make those choices. How's that work?
It starts when you buy your insurance policy. For example, they'll say you can go to this doctor or you can go to this clinic, but you can't go to this other clinic. And of course, the problem with that is that if you don't go to the right clinic, you don't get your bill paid.
And so the right clinic isn't always the best clinic? Is that what you're saying?
I think when we talk about clinics and the right clinic, we have to think about choice. In other words, what clinic does this patient want to go to? What doctor does this patient want to see? Certainly, if I were going to pick a doctor, I'd try to find one who I could talk with and who would listen to me.
Makes sense. Now, you've put together this video course. You've got these upcoming book that you're doing. Who's the primary audience? Who should be looking at these and reading these?
Well, I would be flattered if I could get pregnant women and their, moms and dads involved with these books and videos. I do have a video of my quads. I have a batch of quads. They're all living. It's about an hour long and it's on YouTube and it's free. But it demonstrates very precisely what happened in that relationship that I had with that family. This lady is a newspaper lady, so she's very eloquent. Her name is Sandy. we had a good time during that. That was my passion, to deliver those 4 babies alive. And not only did we do that, but they're still alive at 22 years.
So if I'm a pregnant mom and I'm watching this and I decide to watch your video and read your book, what am I going to learn? What am I going to take away from that that's important?
One of the most important things that is in the video is blood pressure. In other words, blood pressure is kind of the key to many problems. Right now, we have a lot of maternal mortality that is associated with hypertension or high blood pressure. If you know, and the treatment, of course, is the same for everybody. It's delivery. But I just read an article a few days ago. It had to do with this mother died 4 days after delivery, and I think it was from a ruptured liver. And that was one of the things we learned, and I have talk about in the book, and that is, just because you delivered doesn't mean you're out of the woods. So there's a lot of, that can be the worst time. It can be the most difficult time to manage. But in defense, these doctors said, well, she's so far away from delivery, we weren't worried about her. Well, that's not a good recipe.
Now, how is blood pressure related to that? I'm curious.
Well, blood pressure is the beginning. It's really it's the first sign. And you really have to understand blood pressure very well. The real problem comes in from the young mothers who have a blood pressure of, say, 90/40 when they come in for their first visit. If they go up to 140/80 or 90, they've got hypertension. So it's relative. I have also had patients who come in with a pressure of 150/90 on their first visit, and they deliver without any trouble. So you really have to put everything into context.
Now, I know in your book you talk about the ability to take your own blood pressure at home. Is that right?
That's very important. As a matter of fact, that's something that I had most of my mothers do. As a matter of fact, there's the British Royal, this is from England, of course, Royal Academy. They have a little monograph about how exactly to check your blood pressure. And they talk about sit up in your chair, put your feet flat on the floor, and rest your arm in front of you, and check your blood pressure once a day, and check it twice every time you check it, and then take the least or the lowest blood pressure. Again, I think that's a little bit misleading, because it's not the low blood pressure that's the problem, it's the high blood pressure. And that happened to me many times. My patients, I'd find a high blood pressure in the clinic, I'd send them to the hospital, and the nurses would check their pressure until it came down. Well, that's not the problem. The problem is that it went up in the first place. Mm-hmm. So I think we really need a lot of education about that one topic.
I agree with you. I think there's so many people who are so just ignorant about the things they need to know about in terms of their own health in general, let alone when this is one of the most important health challenges, if you might call it that, or there's probably a better word for it, but it's a really important stage of your life where you need to really know what you're doing or work with someone who does. Obviously, you're someone who knows a lot about it. You put together these videos and this book. Before we draw this to a close, I'm going to ask how people can get in touch with you. Any final words about birth, about infant mortality, about mother mortality? What would you have to share with us?
One of the things we talk about in the video, and we'll talk about in the book, is how to reduce the cesarean section rate. When I started my first practice, the cesarean section rate in the hospital I worked at was 15%. I thought that was terrible. Of course, today it's 35% or 30%, depending on where you are. But there are several ways to decrease the cesarean section rate. One would be something called the VBAC. That is a vaginal birth after cesarean section. And I talk about in the video how that evolved. In other words, from 1975 up until 2010, what happened in those years.
Very good. So I'm curious, just if you know the answer to this. I've heard that a natural birth, meaning, vaginal birth, there's something that happens in terms of the baby, in terms of it coming through the canal, the stress it's created, that creates some kind of reaction. There's different hormones created that they actually need that pressure to develop emotionally in terms of their resilience and things like that. Are you familiar with that?
No, I'm not familiar with it, but I do know that we have never proven Pitocin is safe. I'm very much a fan of natural labor.
Right. Me too. Very cool. It's interesting. I was reading an article about people in Brazil and how all these women were choosing cesarean simply because they didn't want to go through the pain. And it was just like not the healthiest thing to do, but yet it would become a trend down there, which is kind of unfortunate, I would guess, based on what you're teaching us.
Well, unfortunately, there's more and more women who have cesarean sections. And there are risks, of course, with that. You can ligate a ureter, which is the tube that goes from the kidney to the bladder. And that's a big mess. You can have bleeding trouble. Sometimes I've heard about 15 units of blood transfusion, And of course, there are those women who actually die during cesarean section.
Not good.
Yeah. Well, natural labor is less painful. And that's why I think, if you really keep things natural, you don't even really need an epidural.
Mm-hmm. All right. So if people want to contact you and want to get a hold of your videos, they want to get a hold of your book, they want to talk to you because you're an expert in this field, how do they contact you? They
can go to my website and the URL will appear on the screen.
Very good.
And to YouTube, see my quads video.
Okay. Very good. Just look up Alan Lindemann on YouTube. All right. Thank you very much for joining us.
Thank you.